We are now demonstrating the varnish fluoride procedure. You will give the patient several paper towels. Stay attentive to the patient. Never leave the patient unattended during a procedure. You instruct the patient not to swallow. Seat the patient in a supine position throughout this procedure. You will then dry the teeth with 2x2 gauze and instruct the patient to remain open so that dilution of the fluoride does not occur. When you open the varnish package, depending on the type of package, there will be a little brush, and then you will need to mix the varnish to mix it up a little bit.
I like to bend my brush a little bit, just a little bit, so it has a little bit more of an angle, so it's a little bit easier to get around some of those corners. So, Michaela, I'm going to need you to open really big, and I need you to stay open. Do not close, okay?
So right now he's drying the teeth with 2x2 gauze, and then he will systematically brush a thin layer of fluoride varnish over all tooth surfaces, including areas of recession. For the adult patient, you will apply to the mandibular teeth facial aspect first, then occlusal, then lingual, and then the maxillary palatal first, then occlusal, and then lingual. I'm sorry, occlusal and then facial.
Outside in, inside out.
And so you see that he's not being very direct as far as like you're painting fingernails. You're just placing the brush and smearing it over these surfaces. This procedure is slightly different for pediatric. Refer to your clinic manual for that sequence. Then at the conclusion, you will quickly sit the patient upright, instruct the patient to remove
Spin that cup for me.
any excess fluoride and saliva by expectorating into that disposable blue cup. You will never use the saliva ejector or HVE for varnish because it will ruin the lines.
And no spitting in the sink.
Yes, no spitting in the sink. That's what the blue cup is for. You've already given them their paper towel so then they can wipe their lips after they're through expectorating. They will give you the blue cup. You will dispose. You will verbally inform them of their home care instructions, again, providing them that written form as well. They will avoid drinking hot drinks or alcoholic beverages, eating hard foods for at least 4 to 6 hours. Avoid brushing and flossing until the next day or for at least 4 to 6 hours. Avoid other fluorides such as gels, foams, rinses for 24 hours. Avoid fluoride tablets for 2 to 3 days. Drink through a straw for at least 4 to 6 hours. Their teeth will feel like they have a coating or a film, but that is normal and that will be removed by their brushing and flossing. That's very important that they know that. This concludes the fluoride varnish procedure.